What is up, you guys? Stick around for this whole video and see how we get this ingrown toenail out of this patient. So this is a 12-year-old kid, and he had an ingrown toenail from, guess what? Cutting his nails the wrong way. Very common. We see this all the time. Patients will cut their nails improperly, pull on it, the nail gets ingrown, and then they're in the doctor's office and we have to get it out. So let's check this out. Let's watch how we do this. First, we have to numb the toe. We use some cold spray, and then we inject the area around the entire toe. Most people think that you're going to put the needle in where the ingrown toenail is, where it's painful and that infected spot. And we can't do that because, well, one, it's very painful, and two, the medication doesn't work in that area because it's infected, and the high acidity will stop the medicine from working. So what we do is we block the nerves around the base of the toe. It's less painful, it's simple, and the entire toe is numb. So when we do this procedure, the patient has no pain at all. If they're having a little bit of pain, we sometimes have to give a little bit more of the anesthetic agent. So you can see we're blocking all four nerves. We go on the bottom of the toe. That's the last nerve. You might think this one's painful, but we saved that one for the end because the other nerves have started to get numb. So here we go. The toe's numb. We're now putting on the tourniquet. We put the tourniquet around the base of the toe. There's a couple of different options. This is the Penrose type drain, which we put around the toe. There's some newer ones that have been created. You'll see those in some of my other videos. You can click on one up here. If there's one up there, hopefully I put one there. So now we go in and free up the toenail. We're getting under it with a freer. Sometimes there's some infection under there you'll see come out. Squeezing, we're not getting any of that. It's just some bleeding that's occurring. After we do that, we're going to cut the nail, and this starts our pathway for where we're going to split the nail so that we can remove the ingrown portion. And once that ingrown portion comes out, the infection is gone. We don't even have to treat it with an antibiotic anymore because the offending border or the offending problem that created the nail is gone. Created the infection, is gone. So now we're using what's called a 62 blade. This is a small blade, and we're going to cut all the way along that side of the toenail that was ingrown. We go all the way under the eponychium. That's the medical term for the word cuticle, if you didn't know that. We go under the cuticle, cut the nail. Now we're going in with these hemostats, or like pliers. We grab onto the nail and it pops right out. This is pretty simple. See, there's a little piece of nail. That's what created this problem. That piece of nail got left behind when the patient was trying to fix the problem themselves. So you might see some skin that's in there, some debris. We're removing all of that. We want to get that out. Oh, look, that was a long piece. We want to get all that out of there to make sure this doesn't stick around. Bacteria can collect on it. It can create for a problem. There's some fatty tissue that sometimes gets stuck in there. We're going to remove that. And now we have a nice clean nail border. So the infection will calm down. The patient will be much happier, less pain, and it'll resolve. In this particular patient, we're going to let the nail grow back because they were a young patient. If it keeps continuing, we can do something permanent called a matrixectomy. You can see that in some of my other videos. So I hope you enjoyed this video. Please make sure to hit that like and subscribe button. I have thousands of hours of intraoperative surgical videos, as well as clinical videos that we're doing every day, as well as educational videos that I'll be posting soon as we get time. It's a busy practice, so I'm doing my best to get these out there for you guys. See you soon.